Our main purpose here is to teach clinical success to general practitioners through a combination of knowledge and to a combination of providing patient treatment experiences to general practitioners using committed and dedicated faculty. We're here to make you more successful in your private practice.
We like to think in terms of our program as being quite unique in the terms of not only of us supplying the patients, but also giving a very strong didactic background in the principles of implant dentistry, as well as training doctors to perform their procedures in the office in a very professional manner.
Now, we all know as surgeons that hands-on, especially on a live patient, is so critical because you can feel the hard tissue and soft tissue, which would be completely different in many other courses which offer hands-on on models or on pig jaws or cadavers. Nothing beats learning on a live patient.
I think that's the most crucial part of this whole program, is that once you learn, conceptualize the material, that you have to touch it, feel it, it just brings it to a whole different level. The learning experience just goes exponentially from there.
Ten years ago, we created this continuing dental education facility for the sole purpose of providing clinical training to private practitioners. We have 15 state-of-the-art operatories. We have a 52-seat theater. We have an operatory under glass. And those things in combination increases your quality education experience.
The lectures and the didactic portion of the program are invaluable.
That's what makes this course different from all the others, because we look at everything. We look at occlusion, we look at prosthetics, aesthetics, surgery, different parts of surgery. We have people from every discipline coming in to speak to us and teach us about implant dentistry.
I've been with this program since 1997, and I have seen several lectures multiple times. Some of those lectures have given the same lecture, and it was a completely different lecture to me based on where I was in my learning curve. There's so much information to gather here, and the nice thing is so many of the people that lecture are accessible during the day here.
The clinical procedures that the participants gain from this program allow them to take things they can learn from the program and actually implement it into their private practice the very next day.
Being in my practice, doing crowns, bridges, root canals, they were great things, but after a while I just wanted to advance myself and I wanted to provide my patients better treatment options.
By taking a course like this at NYU, patients are more likely to follow through with my proposed treatment plans, and my case acceptance has gone way up.
This course gave me enough confidence to be able to offer advanced stage of dentistry, something that I wasn't able to offer before.
I have found that after doing the course, I now have mentors, people I can call on anytime. If I have problems in my office, difficult situation, there is always somebody I can pick up the phone, I can call them and say, hey, I need help. It becomes like a family situation. It really makes a difference in your practice.
You will become a better dentist at the end of 2 years than you were before. It's not just about learning implant dentistry.
I run into dentists who have taken this program many years ago, and they'll come over to me and tell me how the program has actually changed their lives, both professionally as well as personally. It's helped them to build their practice, and during the time that they're in the program, many of our doctors are already placing dental implants in their office before completion of even the first year. So they start reaping the benefits very early on.
I've been in this business for over 30 years. This is my life, this is what I do. I really think in the area of implant dentistry, there's no one better. We have the facility, we have access to patients, and the most important thing is we have the committed, dedicated faculty.